Good morning. This is Kim Kennard with Cornerstone. We welcome you to our small group rollouts for 2021 plans featuring MMO and UHC this morning. MMO will be our first hour, UHC is our second hour. Oops, trying to get it to advance. Just a little housekeeping. If you have a question, please type it in the question box. We'll try to answer your questions at the end of each presentation. However, if we run out of time, we'll follow up with you because it'll tell us who asked the question, and we'll get back to you on that. This is me and Jeff Lewis. If you don't already know, my name is Kim Kennard. I'm Director of Employee Benefits here at Cornerstone. My information and my colleague Jeff Lewis's information is right there on the screen if you'd like to get in contact with us. I'm in Northwest Ohio. Jeff is Northeast Ohio. And of course, my counterparts Nelson Culp and Shelley Brownell cover the other parts of the state. Jeff is on vacation today, so he sends us greetings from either a golf cart or some beach chair somewhere in South Carolina. Just briefly, we'd like to introduce you to Autopilot. If you haven't heard about this, it's a compensation-based client referral program that offers services of licensed reps to quote, enroll, support, and provide year-round service to clients that may fall out of your business scope but never off your radar. Under this program, you can focus on growing your business with the assurance that your clients will continue to receive the benefits of your market expertise and continued superior service and support. Our talented team will take care of your clients' health insurance needs for individual and family coverage, employee benefits, or Medicare solutions, whatever makes sense for your business. Contact your local Cornerstone rep if you want to learn more. Another program that we talk about periodically is our succession planning program that helps you arrange a strategy to provide your beneficiaries with income, along with peace of mind in the event of your unexpected death or disability. This includes drafting communications to your current clients in the event of your death or disability, preparing your business and beneficiaries with a financial plan, and conducting annual reviews to audit your plan and make any necessary changes. We walk you through each step of the process, ensure your business and your legacy are covered. Learn more on Cornerstone's website. You can contact Jeff or I, Nelson or Shelley if you want to learn more. Now I'm going to turn it over to MMO, our lovely guest. Dan Polk is here with us today in the house. He'll kick off the meeting. Cornerstone and MMO have expanded their GA partnership footprint outside of Southwest Ohio this past year to help smaller agents or those just starting out. This includes Northwest Ohio, Columbus, and Eastern Ohio. We're excited about this because we really enjoy working with the MMO team and offering our agents more of that one-stop shopping to simplify their lives. Just so you know, we have a pre-approved list of brokers we're able to reach out to. If you got questions, you can connect with your MMO or Cornerstone rep for more info. With that, I'm going to turn it over to Dan Polk, and just bear with me while I switch the screen over. Jess, if you're listening, I need to switch the presenter to MMO. There we go. And we got to hook up Dan here too.
I'm hooked up.
Awesome. All right, I'm muting myself.
Can everybody hear me? That's great. Thanks. Yeah, this always kind of freaks me out because I'm looking at like the arrow going around on my computer, and it was like I have no control. I don't like having control. Good morning, everybody. My name is Dan Polk. I'm the Vice President of Small Employer Solutions for Medical Mutual, which basically is the handling the under 50 market throughout the state of Ohio, and I'd like to thank our partners at Cornerstone for giving us the opportunity to give a little update on what to expect for the small group market, the 2 to 50 market, as we head into the fourth quarter and heading into the fun fourth quarter towards January 1st. Just want to give just a quick synopsis of just Medical Mutual just overall. I know obviously obviously everybody's very familiar with our service and with our products, and but really what I want to emphasize is, again, Medical Mutual is the differences within, it's right within our name. I mean, we are reminding everybody, we are a mutually owned company. So which means that our our company, really our policy is owned by our policyholders and not so much our stockholders, the stockholders that our for-profit companies report to. And we're not loading 7% of profit for Wall Street, and our gains are put right back into our surplus for the protection of our policyholders. We also have a strong commitment to our community. That's part of being a mutually owned company, which is exactly where we live and work. And our actions should also demonstrate this commitment. We're very civic minded. We have upper management serve on several nonprofit boards throughout the state. And just wanted to bring up again, and I think most of you are aware of this, but the Mutual Appreciation Program, which is a program that was established several years ago, in which we incent our employees to use and purchase the goods of our customers. And year to date, just to give you an example, year to date, our employees have spent over $19 million through the goods and services of our customers. Now, we're in the middle of a pandemic, so a lot of our customers are bars and restaurants. You can kind of understand that, but still, $19 million is just a huge number. Just again shows our support, for our customers. Actually, since the inception of the program, our customers have spent over $178 million since the program started on our customers. So it's a program we're very, very proud of. And of course, the heart of our charitable giving lies within our employee volunteer program, which is known as SHARE, which is Serve, Help, Aid, Reach, and Educate. And its mission is to promote the importance of the community involvement through volunteerism of our employees, and they volunteer for a variety of organizations throughout the state. And again, as far as the Cornerstone, Kim kind of stole some of my thunder on that, but we have over a 25-year relationship with Cornerstone, and as she mentioned, we have expanded as Cornerstone has expanded throughout the state, seeing that Medical Mutual is a regional carrier, is a state carrier. We're from Ohio. We serve our Ohio customers. And it just seemed to make sense that as Cornerstone expanded throughout the state, we should with them as well. So we have expanded with Cornerstone and the brokers that do roll up through Cornerstone for Medical Mutual products. And we're thrilled to have that relationship and, and continue to grow throughout the state. Now, that being said, I do have on the line, I think almost all of our 2 to 50 reps. And just to, run through it real quick, our reps will work through Cornerstone on your business, on your Medical Mutual business. Of course, we have Sarah Jansen out of the Cincinnati-Dayton market. Sarah Pryor works the Columbus, really the central part of the state. Jen Anglin is out of the northwestern part of the state. Jen Stanton and Laura Sturgeon both work in the northeast Cleveland area. So we're glad to have them on board. And I don't know if they're going to be talking later or not, but they're on board to answer any questions possibly we might have coming from you all. Really, that's about all I have as far as the Cornerstone relationship piece. We're thrilled to be here today and give you a little update. We have a lot of information, not just on the products that are coming out for 1/1 and information on rules, which I'll be coming back and talking a little bit more later. But we have some other new programs, and I think right now we're going to head it back over to Tracy Shook. I think she's controlling the slide deck right now, so we'll let her take over as far as what else is going on within the company.
All right. Good morning, everyone, and thank you, Dan. My name is Tracy Shook. I'm the Director of Growth and Retention for Medical Mutual. We wanted to go over this morning for you a little looking forward into 2021, which is really comprised of 2 different parts. I thought it would be a good time to give an update on COVID-19 and what Medical Mutual's response has been. And I have some hot off the presses information to share with you also this morning on that topic. And then I'll turn it back over to Dan to talk to you a little bit about some small group updates. This next slide here actually was updated at the end of August, so it's a little bit outdated. We're about another month past this, but we wanted to just give everybody a good view into what the numbers have looked like regarding COVID at Medical Mutual. And we wanted to give you guys kind of the overall picture of how it is affecting us as a company, so you have a better understanding of how we are delivering services during COVID to your members that are insured with Medical Mutual today. So on or around September 1st, then, as of March, when the pandemic began, we have lost about 23,000 members due to attrition. So that would be layoffs, businesses closing, and true downsizing or shrinking or furloughs from our employer, mostly from our employer-related groups. So that's important to remember because we get a lot of questions about, how we are being impacted. So it's important to remember that, that's enrollment that we are losing that we do have to replace in some fashion. So based upon COVID-related claims, I'm sure we are in excess of around 80,000 now. My slide says 79. Again, this is about a month out to date. But we have around 80,000 different COVID-related claims that we've received in the door. That includes hospitalization, testing, that includes doctor's visits, etc. As of this date, we also had around 33,000 related testing claims. And I have a slide a little bit later on that will indicate to you that really from March to around August, we've seen 6 times the amount of testing claims come in. And if you listen to any of the updates from Governor DeWine, they'll continue to reiterate that testing isn't even truly still fully online per se with all the different methods. So we continue to anticipate that will go up. Obviously, we see there are still, a vast amount of new daily diagnoses. So we continue to receive and pay those claims, obviously. From there, we've had about 625 actual hospitalizations. Some of those obviously would be ICU submissions or admissions rather. And then we've taken a look at, truly the average COVID-related hospital claim is in and around 25,000. Interestingly enough, per claim. Interestingly enough, we see that number change a little bit depending upon the book of business we're looking at. So if we're looking at Medicare, if we're looking at our commercial book, it does change a little bit. But that'll give you some kind of idea of what we're honestly seeing from the claims perspective. To date, a little bit about what Medical Mutual has done as a health plan and to provide some financial support for our members and member groups. Obviously, we are following all of the Ohio state of emergency guidelines and mandates, as well as the CARES Act on the federal side and the federal state of emergency. Some of those things are covered within here. They're not stipulated as such, but certainly we wanted everyone to know from a health plan support standpoint that we are covering COVID diagnosed treatment at 100%. We as a carrier made that decision very early on during the pandemic as we felt it was the right thing to do due to the unexpected expense that most people that were ending up to be hospitalized especially were going to incur. Note that we're mostly talking about small group today, so our small group plans do include that 100% treatment. Note that if you do have any self-funded groups with us, we did ask you for a decision on that because it was up to each health plan. Back at the beginning of the pandemic, we also really started to tightly manage disease management and care management for our at-risk members. So when I say at-risk members, it doesn't necessarily mean just those at risk for COVID, but those at risk with higher medical claims, et cetera, to make sure that they needed anything from a care perspective that we would assist in providing those things. Due especially to the shrinkage or the availability in care that was evidenced or experienced at the beginning of the pandemic. For example, one of the things that we did is we did make sure that those that needed certain medications, we relaxed out of the medication limitations very early on, and we worked to ensure those that had medication shortages not related directly to the pandemic from a COVID standpoint, although it's certainly caused by the pandemic, had access to prescriptions that they needed prior to their filling limitations, and actually worked very hard to find specific drug replacements. The other thing that we did that we do a little bit differently is our telemedicine model. We're working to, and we're continue to work on this, but at the beginning of the pandemic, we went through and we helped rapidly expand our telemedicine model. Our telemedicine model is a little bit different than several other carriers. We chose several years ago to actually work with several of our already networked credentialed provider groups to credential their actual telemedicine solution. So the thing that we see out there in the marketplace today is most of your large provider groups have come up with their own telemedicine solution. So we began working with additional provider groups that we already had in network to credential their telemedicine portion of their facilities. One thing important to remember about our telemedicine is essentially if it is in network and they offer a telemedicine solution, the claim should be considered obviously in network. However, for the purpose of COVID, remember it does have to be medically necessary. So each of those providers will take you through a screening questions to decide whether they're going to code that claim for COVID. The other thing to remember is only certain provider groups at this point in time are set up for what we would call on-demand services, meaning when you log into, for example, Cleveland Clinic's online telemedicine solution, it will ask you for your coverage information, actually collect your appropriate copay at that point in time. So that would be one thing to keep in mind. All systems are not set up for that. However, they will typically bill you as they would for any other service. Otherwise, if they are collecting money from you up front for a telemedicine visit and they are in network, you may need to submit that claim to us. We continue again to work with all of our credentialed network providers if they do have on-demand services to get them online. That does require some IT setup and some integration, so that does take a little bit. We continue to relax the eligibility and coverage continuation rules. So back at the beginning of the pandemic, prior even to the Ohio mandate, medical mutuals, executive staff met and quickly decided that they wanted to relax the ability to keep furloughed employees and those not actively at work on the plan, as long as the employer continued to pay their portion of premium and as long as they continued to collect that portion of the employee's cost share. So this has been ongoing for us. It was eventually picked up then as an Ohio mandate and will continue to be required as long as the Ohio state of emergency is in place. Just a reminder that the Ohio state of emergency does not have an expiration date that is published, unlike the federal state of emergency where we see some of the CARES Act requirements come into place. Medical Mutual has, up to this point, provided a reassurance date, or what I would like to call a reassurance date, by saying that we would continue to relax eligibility requirements until either X date and or the end of the state of emergency. We've been providing that reinsurance date in case the state of emergency were to run out, so that way groups have planning and a date to actually target. We did make the decision late on Friday. We'll be updating our materials that reassurance date, which was set to expire at the end of this month, will be kicked out to the end of the year, so 12/31. Again, we are required to do this as long as the Ohio state of emergency continues to go forth, but that's just a date in which your groups can use to plan. So that's hot off the presses. Obviously, we've allowed some special enrollment periods. We had one very early on for our fully insured book and continue to work with our self-funded groups. If they would like to offer a special enrollment period through the CARES Act, we are required to do that. Again, on our fully insured block side, we do get questions asking to add people on as late entrants, but just a reminder that our special enrollment for COVID was earlier on in the pandemic. I believe it was in May. So those would be any exceptions would have to be taken a look at on a one-off basis, since that open enrollment already did pass us. So. And then we also chose to relax our deductible credit rules for groups, individuals moving from a group plan to an individual plan to ensure that they received credit. We do have, interestingly enough, some groups that are moving back and forth now, and we're reviewing what we can do from that standpoint. We now have groups that were on a medical mutual group, went on individual, and are now looking to come back to that group. So we're making sure that we can hopefully support credits in all directions, but we are working on the return to group decision at this point in time. From a financial standpoint, again, Ohio is mandating, as long as the state of emergency is in place, that there is a 60-day grace period for fully insured groups to be able to take advantage of that, to spread out their premium payments. I always just like to give a healthy reminder at some point in time that that will run out. However, and groups will need to be able to catch that up, or potentially 2 months at one time. So we'll continue to work with that as that situation unfolds. And then obviously we've taken a look at our self-funded accounts to make sure we're working with them very closely on anything we can do to assist them. Testing and treatment is covered, again, under mandates with no member cost share. However, I will remind you that that testing and treatment does need to be medically necessary, especially on the treatment side or the testing side. So we've been defining medically necessary as someone exhibiting symptoms or has been exposed to. What is not covered under 100% testing requirements is non-medically necessary. So that would be screenings for sports, screenings for employment, and et cetera. So, or if you just wanted to get tested. So I just always like to cover that to make sure everyone understands the difference there. And we do continue to look at how the overall block is running. I have a slide here in a couple of seconds. I'll talk a little bit more about that and what some of our conversations have been. So just a quick response again, these mandates here that you see for testing, for diagnostic visits and testing, it really began to be mandated for 100% coverage back in January, and at this point in time are covered by the federal state of emergency, which is now set to expire on October 22nd. Obviously, that can be extended and will likely be extended, but last time we did not hear about that until the very last day before. So we'll continue to update you on that as we are able to. And again, you know, we are taking a look at what we do and continue to do for treatment. And, you know, right now we have made the decision to cover treatment on fully insured groups at 100% as long as the Ohio state of emergency stays in place, although it does not mandate it. It's just what we've chosen to somewhat follow as our rule of thumb. And this is just a nice timeline you can see here for what we've seen from COVID. You know, back in early March and early April, you know, we saw the shutdown and cease of non-emergent care, and we saw our initial peak in Ohio. We saw a decrease in ER visits and also a decrease in potentially members seeking care for strokes and heart attacks. Hospitalizations remained pretty consistent for COVID during that time frame. And then you saw in May, you know, when non-emergent care resumed, supposedly we were flattening the curve then, and we did see a resurgence then in June. But we did begin to see COVID claims beginning to rise back in May. In June, we saw that spike, you know, presumably from Memorial Day. And we had a lot of limitations, obviously, as we've all lived through, that were put into place. The interesting part begins to be what we've seen in July. So we did see surgeries rebound in our Medicare population and rebound to pre-COVID inventories, which isn't necessarily not surprising, but it does show you that in that Medicare population that people did begin to seek care that they had missed. And some of that care would not go unmissed, in other words. And then, as I mentioned before, our testing claims, we started to see almost 6 times the amount of testing claims that came in July and early August versus April. And then in August, obviously, we started to see the surge continuing, and we see some of the mandates continue to stay in place as far as recommendations for social distancing, et cetera. And then just to round things out, I just wanted to share with you a little bit about how we're looking at the rest of 2021 and then talk a little, or 2020, and then talk a little bit about 2021. From a hospitalization standpoint, there's truly little variance. We're seeing, you know, in essence, a slight decline in COVID-related hospitalizations, as we're seeing, from the state and the state's information, but we are seeing a slight increase, like I said, in, regular care returning, especially in that Medicare population, and we expect that to normalize the farther and farther we get through 2020 to pre-COVID, non-COVID related inventories. We do see COVID cases specifically that have been hospitalized run at a higher average cost, as well as their post-discharge care needs seem to run higher than the average cost. And then obviously we've seen a huge increase in testing. We can anticipate that that will continue. There is no cap on testing, so some people are getting tested multiple times in multiple different places. So that number isn't necessarily that I shared earlier for occurrences, but certainly, for repeat testing as well. We do see a lot of our hospital groups and provider groups that we work with are working to increase their capacity to make up for lost revenue and services that they could not deliver during shutdown. And we certainly have seen those non-elective, non-essential services, come back at a pre-COVID type of rate. It all depends on the population we're looking at. Some people are certainly still avoiding care, some are not. And then we take a look at, what's happening with enrollment. Certainly we continue to see layoffs, or some groups or businesses that have still been hit economically by the impact, having to make difficult decisions to either close and or cancel coverage. So we're watching that very closely. As I mentioned before, we do watch that attrition number to ensure we're taking a look at how that impacts Medical Mutual, but also you as brokers and groups. And then we have not seen, there was a large anticipation by those overseeing ACA that we would see, the people losing group coverage roll into individual. We have not seen that at Medical Mutual at this point in time yet. So when we hear about the number of uninsured rising, we believe that to be the true case. It's not like there has been a direct relation in that enrollment being lost from group heading into individual. So we are working very closely with brokers and with our groups, doing some mailers to those that are losing coverage under the group side if their employer did not choose to keep their employees on, to see what we can do to capture that enrollment and ensure that people do have coverage during this difficult time. And then last of all, the overall net cost of care is truly hard to predict at this point. Obviously, there have been some positive impacts to our loss ratio given missed care. However, again, we have seen resurgence in care. We've seen increased COVID claims, both for hospitalization and for testing and treatment. So it really is difficult to predict at this point in time what will happen. We are, as a mutual company, trying to do our best to keep things stable, for our insureds, meaning we haven't rushed to give any type of rebate out, but we're looking more at managing our overall cost of book of business for our groups and taking a look at what that means on a longer term basis. And then we have seen, like things, people aren't always in tune to the fact that, when we allowed for early refills, et cetera, there certainly was an increase in prescription drug claims that was higher than usual. And then last, considerations for heading into 2021 with the pandemic. Really, we're taking a look at the current and future potential surges, right? So we're not out of the current surge we're in. We're looking at, and have been hearing for months now, that it could be compounded by the flu season. We're working to see what we can do on education modules in certain product lines to ensure that people are aware of the importance of getting their flu vaccine this year and having access to that. So we'll have more information on that soon. And we're, again, looking very closely at what we can do at the migration of lost group members. Again, we're looking at individual mailers to those that have lost coverage for potential short-term major medical policies and individual policies. But we are seeing people just opt for no coverage. And we're working, obviously, to see what we can do with those large self-funded groups and special open enrollment periods. And then we're watching the state, of how it is affecting not only Medical Mutual's claims and its customers, But we're looking at the overall situation because there is certainly some concern from a cost perspective because people are delaying health services. And when we see a delay in health services, that typically means that the end of cost of care ends up being higher because any current health conditions increase in severity and then increase in the treatment that's necessary. People avoiding care. Unfortunately, we're seeing more and more national statistics that, the initial point of care on things like strokes and heart attacks that I mentioned before, that were going undetected are coming in at a higher point or a more severe point, so that's another consideration. And obviously we're taking a look at what that means at the big picture. We're concerned about there are members that have had COVID that have been experiencing new syndromes like inflammation syndromes we're seeing in children. We are seeing some of those things now come through in claims. And no one really knows what potentially, could or will occur with any mutations of the virus itself from a cost of care perspective. So just to end things out here, to reassure you that Medical Mutual is still actively at work and working hard for you. Very early on, we were very proud of our staff. We moved 97% of our staff to work from home very quickly, and hopefully hasn't missed a beat for you. Our field staff was somewhat used to working remotely, so they have not certainly been interrupted that much, but customer service, membership, those operational areas also moved to 97% work from home. We are now past our first return to work phase where management is coming in for a gradual return on a part-time basis, and then we are looking at individual contributors and managers coming back into the office in January. But continue to work hard for you no matter where we're located at, and we'll continue to oversee the COVID situation for all of you as it continues to unfold. So at this point, I will go ahead and turn it over to Dan Polk for a small group update.
Thank you, Tracy. Once again, you can just flip to the next slide. Just want to give you a quick update on both the on the 2 to 50 and on the 2 to 50 book of business, what to expect come the fun fourth quarter heading into January 1. For the COSE Health and Wellness Trust, that's our MEWA that we have. Just a little update and just a little more information on that is that the COSE, the trust has actually grown to over 7,600 member groups, which is amongst the largest of its kind in the country. So we're very proud of that since we started the program, and covering over 65,000 members. And it continues to grow. So not only does it continue to grow, but we also continue to retain that business, and that's a huge thanks to all of you and our our partners at Cornerstone as well for helping us retain that business and continue to grow, because obviously, as we all know, there's strength in numbers, and COSE has been doing it for a long time. As as most of you are aware, COSE stands for the Council of Smaller Enterprises, which has had a similar program in place for well over 40 years with Medical Mutual. So as far as what to expect coming into January 1st for the renewals, keeping in mind that all of our groups do renew on a rolling 12-month cycle. So the entire block does not renew one common date. So January groups that have a January 1st effective date, they will renew obviously January 1. If they have a February 1st effective date, they will get the renewal February, the following February. And I say that because this past May, if you recall, starting with the May 2020 renewals and new business, we did implement a few benefit changes within the existing benefit portfolio, changing some office visit co-pays, some deductibles. That started again May of 2020 for new business and renewals, and those are being implemented as the months go on. So come January, those changes will come into play again, the changes that we made back in May for the January business, and those benefits, you'll see a mapping in the renewal showing which their current benefit and what is being mapped over to. Not huge changes, But again, just mainly a couple of changes in some copays and some deductibles. Those will be obviously again replacing those existing plans. As far as Form Fire is concerned, I know we just recently sent out a notification that one of the things that we've been hearing from the market is that a lot of our members, as they're applying for the MEWA, are not seeing the terms and conditions as they sign off on their application. So Form Fire is sending out an email to all the HR directors for the applying groups, reiterating what the terms and conditions are and making sure that their employees are aware of them as well. Now, we are also working with Form Fire, and hopefully I don't know if we'll get it done by 1/1, we're hoping to, but maybe sometime in the first quarter where there's actually going to be an acknowledgement by basically just a check mark from the applying member saying, yes, I do. I haven't read the terms and conditions. And again, just keeping in mind that, the reason why we do this is a MEWA is it's a different animal. This is not a spreadsheetable, fully insured product. This is a self-funded trust. And obviously we have to protect the trust. So there are times when we run into some situations where some undisclosed risks where we do have to, we have to audit those. So again, this is just helping to reinforce those terms and conditions for the members. So if you have any questions on that, you could reach out to Cornerstone or the your medical mutual representative, at the time. So as far as the performance goes on the COSE MEWA, the good news is that the overall it's running about 3% better than it was heading into January of 2020. Now 3%, again, it doesn't sound huge, but actually with such a large block, it really is. And as a result, approximately 70% of our members will be receiving single-digit increases. So, that's all good news. The trust is running extremely well. We continue to grow, and we look forward to retaining that business come 1/1. We do expect the January 1st renewals to be coming out over the next couple of weeks. I can't believe that we're heading into October already. So probably the second full week of October, we expect those renewals to hit the street. So you should be having those available to you. So next slide, Trace. There it is. Nope. Almost. There we go. Thank you. Okay, and as far as the fully insured block of business, keep in mind that, again, medical mutual, we have maintained, obviously other carriers as well as us, as far as transitional relief goes, has maintained a grandmothered block of business. But medical mutual also has done a pretty good job. And again, thanks to many of you on this call in maintaining a grandfathered block of business. So obviously the grandfather block is, have very few changes, only what's allowable within the ACA from its inception back in 2010. But that grandfathered block of business, we still maintain about 25% of our block of business in the 2 to 50 market is still considered grandfathered. So, and again, the grandfathered block, even if transitional relief does expire, as it says in the first bullet here, is expected to January 1st of 2022, the grandfather block of business can continue forward, past that date. Now, that being said, with the expiration due January 1st, 2022 for transitional or grandmothered business, we, as we have every other year, we do have several strategy sessions as to how we are going to be handling that transition. And so we just pick it up again every year until, we see exactly if that's going to be kicked down the road again. We do have a pool going on within our departments to see if it will be kicked down the road again. And, it's hard to say. I mean, obviously we feel that it probably will be, but again, when they announced that the transitional relief is going to be extended again through January of 2022, they said, okay, this is it. This is really it. We're not going to do it again. And then they did it again anyway. So we're expecting that it's going to be extended. But again, with the election coming up, there's a lot that remains to be seen on that. So that being said, to be on the safe side, we have to assume that is going to be expiring come January 1st of 2022. And we will be working with all of you as far as the currently fully insured block of business, aside from the grandfathered, which which would make sense for whether it be ACA or MEWA transition into one of those books of business. We've had some as far as retention goes, we've had such terrific retention really over the last couple of years, but especially even last year. Again, we've had over 90% retention overall, and that's between everything in 2 to 50, that being MEWA, ACA, and grandmother, grandfather. And again, that's a big testament to all of you. As Tracy had mentioned, I think we do a pretty good job of trying to keep our renewals down. And again, keeping in mind again that we are a mutually owned company. So heck, if we make 2% as far as an underwriting gain overall on the book of business, we're doing handstands, and that just doesn't happen, right? So, we're very appreciative of the support that we get from all of you on our retention, on your retention efforts on our behalf, and on your client's behalf as well. As far as the ACA goes, ACA renewals will be coming out probably about the same time as you'll see the rest of them. And that goes as well with all of the fully insured. Grandmother, grandfather, probably going to be sometime mid-October. Grandmother, grandfather, you could expect pretty much the same as with the MEWA. We're going to have most of that business receiving single-digit increases. If there are any questions as to whether a grandmother or grandfather piece of business would qualify or would make sense to move over to MEWA or ACA, we would, obviously recommend working with your, cornerstone rep and with your medical mutual sales rep in order to see if it makes sense to move over to ACA or to the MEWA or not. The average, as far as the ACA goes for group, the average increase is going to be somewhere around 4.5% starting January 1st. So, that's obviously a very positive thing. So, we've been seeing a lot more activity in the ACA group world certainly over the last year. So, it is a viable option anymore. So, please keep that in mind when you're quoting, when you're quoting for your clients. As far as any benefit changes for ACA, there have been some adjustments that's allowed within the law, but those adjustments are mainly in the maximum out of pocket and in the MOOP adjustments as allowable, and those will be shown within the renewal as well as far as what those are being mapped to. Grandmother, grandfather, obviously there aren't any changes because there can't be. But grandmothered, of course, you can downgrade to a different benefit. Grandfathered, there is no benefit that you can downgrade to aside from what's allowable through CPI. So that's all there is on the small group update. Again, if there are any questions that you do have, feel free to type in and along the side, and we'll answer them as best we can, or send them in through Cornerstone, and we'll get back to you as far as any questions you might have on that. I think at that, we're going to hand it over to Josh Schneider, who's going to talk a little bit about some of the changes we have coming over in the consumer-driven healthcare within the small group arena, and really touching base on some of the 50+, but primarily in the 2 to 50 market. So, Josh, take it away.
Yeah. Good morning. My name is Josh Schneider. I'm the Director of Consumer-Driven Healthcare Products at Medical Mutual and Product Innovation. I'm just going to take a few minutes, about 5 minutes here, and just take us through some of our consumer-driven healthcare products, the HSA, HRA, and FSA. I guess I think it'd be good to start off with just saying that these are great companion products to the health products. We think they increase the value and member satisfaction, and really can help with retention. All of both the HSA and HRA through Medical Mutual, especially in the small group segments, anytime you purchase a qualified high deductible plan or you have a customer that has selected that product, our HSA will come automatically with that. There's no additional cost. If an HRA plan is elected, that HRA administration would also come with that product. And then the FSA is a voluntary product that can be applied to any of the product lines. But just to kind of drill in a little bit to share with you that we think that when you have any of these three products integrated with the medical, that there's an advantage. Now, if you have had any experience adding on these products to a health plan design, I'm sure you've come across whether there's multiple logins, having to work with multiple businesses and so forth. Here, with Medical Mutual, it's an integrated experience, and we provide options. So, for example, we offer a claims integration experience where any claims would be, we'll be paying providers directly. The employer has controls kind of the flow and where and what is eligible for an expense, or we provide a debit card where we allow the employee to be empowered to make that decision when they want to pay for any sort of member liabilities that they may have. We have a full suite of products. As you talked about the FSA, there's a lot of different products that accompany those, and then again, simplified experiences for both the employer and the employee. It's all supported online with both mobile and online, and it's all single call resolution. One call for both your medical and any sort of questions that support any of these products. You want to go to the next slide. So this is just a snapshot. I think what I've seen in the marketplace is that there's not always choice when it comes, especially to like an HRA. So, and even more specifically in the small group space, we provide options. We're not going to force you or an employer into selecting either, one solution. We know that one solution does not fit all. So claims integration, I'm not going to go through each of the bullets here, and debit carded. These are just some of the requirements and controls and the experience that an employer and a member would have. Clearly, just to throw some, compare and contrast, the claims integration experience, this is where we are paying providers directly. The member is not having to take action as the claim adjudicates through our system. We will pay that liability out of the selected account directly to the healthcare provider. The debit card, that is, again, as I mentioned earlier, it's the member has the choice to swipe the card to pay for that expense. If you want to the next one. So this, I'm just going to switch gears really quick. This is just more, this is a product that's associated with kind of a recent COVID pandemic. So, we just wanted to highlight that we're offering now a Medical Mutual Employee Care Card. When President Trump initiated or activated the Stafford Act, it really does some things through the IRS, right? It initiates what's called as the IRS Section 139. 139 in IRS allows for employers to provide relief payments to their employees on a tax-free basis. So this is, again, different from maybe any of your, anything that's associated with the HRA or HSA or FSA, where there's, monies can only be required to use on certain, 213D expenses. This is a wide range, right? It's really meant to say you're incurring more cost for whatever reason, and the money that employer is giving to employees or participants are non-taxable to the employer, non-taxable to the employee, and they can be used for a wide range. There's no substantiation associated. It can be used for, as you can see here on the slide, grocery to utilities. Some of the requirements that we have to set this up, one-time deposit. So with a minimum of $250, the term of this contract is a 90-day term. Any unspent balances that the employer has given to their participants or employees at the end of the 90-day term will be returned back to the employer. And there is a one-time charge issuance of $5. We're just doing a pass-through. And our intent initially is to make this product available for any employer that has at least one line with us. If you come across a group that's interested in using it, that does not have Medical Mutual for any product line, we can have a discussion about that. And then the next two slides, this Exhibit A and B, are more to be just kind of a leave behind. there's a lot of moving pieces with all three of these products, and having something at your fingertips can often be helpful.
Hello, everyone. This is Jeannie Fueling, Director of Specialty Products here at Medical Mutual. I appreciate the time to take a few minutes to talk about our specialty products at Medical Mutual today. And specialty products at Medical Mutual is simply everything non-medical, so all of our ancillary lines. Give you a quick background on myself. I spent the last portion of my career with ancillary products. I was, prior to joining Medical Mutual, last past 13 years was at a large national carrier, so I was so happy to come over and join the team, the hometown team at Medical Mutual, being an Ohio girl all my life. So I'm going to kick this off with dental, and that may be all that I get through because I think we only have a few more minutes, but I definitely want to touch on dental. We've got a lot going on with our dental products. Medical Mutual has been a dental carrier for 20 plus years, but when they made the decision a few years ago that they really wanted to focus and grow their ancillary lines, they chose to go the route with dental of looking and reviewing and researching and finding a dental carrier that had the expertise that they felt that they could grow with, that they could lean on for that expertise. So we acquired Superior Dental Care, who had 35 years of expertise in dental benefits a couple years ago. We are now in the midst of that integration. It is going so well. We have been taking advantage of their product knowledge, their flexibility, particularly their portal and mobile technology. They have an online account management system for their dental. They have, for their member experience, their mobile access is tremendous, where members can view ID cards, find a dentist, get benefit details and claims. SuperiorDental.com itself is a great resource for dental health with their dental blog and with their Find a Dentist. So we are really taking advantage of all the expertise they have developed over the past 35 years. Together, we have a book of business of more than 500,000 dental members. And we feel that what sets us apart is the integration of this. So you still have your Medical Mutual, integrating, you have your Medical Mutual, the individuals that you work with now, along with the expertise that SDC is bringing in the dental arena. Next page, please. So the biggest, and maybe the biggest area that I really want to talk about that really we have seen a difference in is our network and the explosive growth that we have seen. So prior to SDC, Medical Mutual, we leased Dynamax, which was, it's fine, it's a national network, it's a good network, but by combining the Dynamax network with the SDC network, you can see on this page the growth that we have seen. 158% increase in the Southwest, 71% in the Central. So really, really expansive growth with our dental network, good dental penetration with the network. And this is growing. I mean, this was a snapshot in time a while ago. And since this map, we continue to grow every month, because the beauty of it is now we have our own recruiters. We have more control over our dental network. When you're leasing a network like we were with Dynamax, no control there really. We're going along with whatever Dynamax does, but now we have some control. So if someone drops out of the Dynamax network, the SDC recruiters go after that dentist to try to get them back in if they're a dentist that we need. So that is maybe the biggest part of this whole thing, is that now we have control of it. We have a lot of control over the network, and you will continue to see this network grow and grow and grow. Next page. I do want to talk a little bit about what's going on in the market, particularly the southwest corner of the state right now. SACA is now advocating the Anthem Dental Network. So I want to talk about what that means for members, for brokers, for everybody. All clients, any client now who currently has an SDC SACA plan, they can keep that. They're going to keep it at the same plan, the same rate. We're going to extend those rate guarantees for an additional 2 years. Any broker that works with those plans, their commission as of 1/1, as soon as it renews, it's going to go from 8% to 10%. So we're going to increase the commission on those cases by an additional 2%. So we really feel this is a great opportunity for us. We're going to do a lot more marketing, a lot more expansion. We have sent out multiple communications in the past month. Hopefully, I'm hoping everybody on this line has seen some type of communication about it. We have did a mass communication out to our clients, mass communication out to brokers, explaining what's going on, that there are no concerns. All of our clients will get the same valued service that they have been getting from SBC, and they'll continue to get that. Just again, going back to that network and looking at our network compared to the SBC network compared to other carriers. I mean, I invite you to ask us how we look, especially in the Southwest area. The SBC is absolutely the strongest network. So we have access to a third-party vendor called Netminder, where we can show specific examples in geographic areas how the SBC network stacks up to other carriers. So I ask you to look at that. I ask you to get that information from us. COSE updates, you're going to see a little bit different when you get your COSE renewals for dental, because we are now going to show both the medical mutual plans that you have been used to seeing, as well as SBC options. So I invite you to talk about the differences between those two. The plans are going to be slightly different, just going to give some options and rates and commissions. So you will have a variety of plan options for consideration. So that's kind of a big change that is happening with all of our small group, the renewals that you're going to be seeing in the upcoming weeks. All right, I will move on to vision just real quick. We partner with VSP, who is really the largest vendor the largest vendor out there. They have 98,000 access points. They have an emphasis on the independent provider. We use the Choice Network, which includes the ones you're used to, Costco Vision Works, and then as of 7/1, Walmart and Sam's Club were added to that. So we have some nice plan options under the VSP network that can be integrated smoothly into the health bill, in with the dental, or however you want to integrate it in with the your overall plan. All right, I will jump to the next section, which is our life plan design. Now, these next several pages are very onerous. In the interest of time, I'm going to skim through these real quickly. But we laid out our life plan designs. Tracy, I think we only have 5 minutes, right? So I'm going to kind of just go through these next couple. So we've got our life plan designs. We've got our voluntary. I'm sorry?
4 minutes.
Oh, okay. Okay, so we've got all these are laid out on, hopefully this will be shared with you because it does have all of the plans laid out as carefully as we could. There's also links to our brochures at the bottom of each of these pages. So our COSE 1 to 9 medical mutual life brochure and our COSE 10 plus medical mutual life brochure, those are included. You can link out to those if you've got a copy of this presentation to get into further detail. The next page should be our STD offerings. And then our LTD, which these are basic core offerings that are provided to our customers. Next page is LTD, Trace. And then, last but not least, is the LTD plan design 1 to 9 or 10 plus, where we can offer 90-day elimination period on plan 1. Plan 2 is 180-day elimination period. Again, ask us about these plan designs. Next page. And so the last product I'm going to talk about is our indemnity product, which we came out with a few years ago. So this is an option for small group plans 1 to 50 to be able to put in critical illness, accident, and hospital indemnity. We sell them both packaged together or standalone plans. You can get the critical illness plan standalone, you can get the accident plan standalone. These are 100% voluntary product, guaranteed issue for all these products. There are pre-existing condition limitations, and the broker commission is a flat 15% of premium, non-variable. We have also included links to those products right here in blue. So ask us for more information on these products, but these are available now. And that was a very quick run through of the specialty products. Thank you for your time.
We appreciate it. Thanks, MMO folks.